What's up, guys? Welcome to episode 56 of the unofficial NCLEX podcast. The title of this episode is Determine Which Patients to Recommend for Discharge in a Disaster Situation. My name is Katie Kleber, and I am your host for this podcast. So, when disasters occur, it is essential that we have only the patients in the hospital that truly need to be there. Patients that can be discharged home or wherever, it is important that we get them there. When we're preparing or when a disaster has occurred, we're preparing for a massive influx of patients. And not only are we looking at a lot of patients, we're also looking at resources as well. We may be utilizing a lot of resources and supplies that we can't extend to the normal hospital population. So we want to think about which patients we can safely discharge to make room for patients that truly need to be in the hospital. So we want to think that only the sickest ones are still in the facility. So let's think about patients on ventilators or on some sort of respiratory support, or maybe some vasoactive medications. We think about Levophed, norepinephrine, epinephrine, different medications where if you stop this medication, they will likely die or have profound life-altering effects if they're not receiving this care that they can only receive in the hospital. So, if we're thinking about our, bowel resection patient that hasn't gone to the bathroom yet, and that was he has to poop before he gets discharged, but he's doing wonderful otherwise. He's very stable, and or maybe there's some other patients that physicians are like, hey, let's clear out so we can get ready. Sitting with physicians and the medical team and say, hey, I know on paper this guy looks great, but he cannot go home. Or maybe, hey, this person would be best to discharge, or we could get this patient and these groups of patients out, triage them out so to prepare for these patients coming in. And it's important to do that collectively so that you're making the best decisions together and facilitating quick discharge. Hey, maybe this one we can get out, but it's going to take a little bit longer. So go work on this one and then this one, and working as a team to get patients out, to make room for the influx of patients, or to be prepared for having to get by on less resources than usual. You have to think, maybe if there's a disaster occurring, you may not have, the laundry done like normal, the normal send out labs being able to be processed, or, there's a lot that goes into keeping a hospital functioning. And there's a lot of things that could be put on a pause until that stuff is back up. And so you want to make sure that the patients that are in the hospital are the only ones that are in the hospital, the ones that truly must be in the hospital. And that's an important role for the nurse to play in determining this, because they're the ones that are with the patients all day, every day. We also know their needs and what they need before they get discharged, and making sure we're communicating with the physicians to facilitate this transfer as quickly and safely and smoothly as possible. So this concludes episode 56, Determine Which Patients to Recommend for Discharge in a Disaster Situation. Thank you for listening.
This has been another episode of the unofficial NCLEX Prep podcast. To get the massive PDF guide that goes along with this podcast, head over to nrsng.com/NCLEX-Prep. That's nrsng.com/NCLEX-Prep. That's a free download that you can take with you anywhere, and you can basically have this podcast in text format. Our goal here at NRSNG.com is to give you the tools and the confidence that you need to succeed in nursing school, on the NCLEX, and in your life as a nurse. We want you to succeed, and we want you to become part of this movement of nurses that is dedicated and motivated to learning and becoming the best nurse that they can possibly be. My name is John Haas, RN CCRN, and I'm the founder of NRSNG.com, and I sincerely thank you for being here, and I'm so proud of you for taking this step in your journey. Now you know what time it is now. It's time to go out and be your best self today. Happy nursing.